Do you have allergy symptoms? Maybe sneezing, runny nose, stuffy nose, and you're thinking about taking Flonase? Before doing so, it's important to know when to take it, how to take it, and how it works. And that's what we're going to discuss in this video. But make sure you watch to the end, as I'm going to give you some bonus tips you don't want to miss. Stay tuned. Greetings, health experts. This is Brandon E., your Pharm.D, and welcome to my YouTube channel. Let's jump right into today's topic and talk about Flonase. Now, Flonase is an inhaled steroid used to treat allergy symptoms. It's better suited for those that have more severe or persistent symptoms as opposed to those that have milder symptoms. If you have milder symptoms, it's best to start with an antihistamine like Claritin, Allegra, or Zyrtec. To understand how Flonase works, it's first important to understand why we develop allergies. When we inhale an allergen, being dust, pollen, or mold, the immune system sees this as something harmful to the body. So as a result, your immune system releases inflammatory substances which cause the classic allergy symptoms like sneezing, runny nose, and stuffy nose. And so with all allergy medicines, not just Flonase, they work to block, inactivate, or prevent the release of these inflammatory substances. With antihistamines, they work to block just histamine, whereas with Flonase, it works to block 6 inflammatory substances: histamine, prostaglandins, cytokines, tryptases, chemokines, and leukotrienes, which again is why it is used for more severe or persistent symptoms, whereas antihistamines can be used for more milder symptoms. If you used Flonase before, let me know in the comments. Let me know what type of symptoms you had. Let me know how fast it worked and how long you used it. And if you want to improve your health through lifestyle changes and over-the-counter medicines, become a health expert and subscribe to the channel. Now, Flonase starts to work within about 2 hours of taking it, but it can take up to 2 weeks of consistent daily use to get the maximum effects from Flonase. And Flonase shines in that it treats a wide variety of allergy symptoms like runny nose, sneezing, itchy nose, itchy eyes, watery eyes, and nasal congestion. Now, there are 2 types of Flonase over-the-counter formulations. There's the Flonase Allergy Relief formulation, which is the first one that came out. And then there's the Flonase Sensimus Allergy Relief formulation. And they both are very similar. They both have the same dosing directions. They both have the same side effects and drug interactions. The main difference is that the Sensimus delivers a different kind of spray filling, as it has patented mist pro technology that creates a fine, gentle mist that has no smell and virtually no drip. Also, the Flonase Sensimus pump is on the side of the bottle, and you must squeeze it to produce a spray as opposed to it being pressed down. Now, as far as the dosing for Flonase, the normal dose for those 12 and older is as follows. So the first week you take the medicine, you want to use 2 sprays in each nostril once a day, and that's for the first week or for the first 7 days. From the second week up to 6 months, you want to use 1 to 2 sprays in each nostril daily as needed. And when I was in pharmacy school, they taught us a saying when dosing a medicine to start low and go slow. And what that means is use the lowest effective dose that will provide the intended effect. So with Flonase, week 2 and on, you can use 1 or 2 sprays, but I would start with 1. Use 1 spray in each nostril, and if that can manage your symptoms, stay on that. But if it doesn't, then you can go up to the 2 sprays in each nostril once a day. And then beyond the 6-month mark, if you're still feeling like you need to use the medicine, then check with your doctor to make sure it's okay to keep using. So now, how do you actually use Flonase nasal spray? First, if you're using Flonase for the first time, it's important to prime the nasal spray. Shake the bottle, point the tip away from you, then remove the cap and pump the nasal spray until a fine mist appears. Then you want to gently blow your nose to clear your nostrils. Then put the tip of the spray bottle into your nostril and aim slightly away from the center of your nose and depress the white nozzle on the regular nasal spray or the button on the side of the spray if it's the Sensimus formulation. Gently sniff in the mist once depressing the nozzle or button. Then you want to breathe out through your mouth and repeat the process as necessary. Replace the cap and then store until your next dose. So now, what type of side effects can you experience if you're using Flonase? The first of which is an allergic reaction. Now, I know you're probably thinking, I'm taking Flonase to treat allergies. How am I going to have an allergic reaction to something that's supposed to help my allergies? And that's a valid question. With any medicine, technically you can be allergic to it, but allergic reactions are fairly rare, but they are possible, so I'm just letting you know to be informed. If you have sudden swelling of the face or tongue, you have a rash, or you start to wheeze, or you feel faint, this could be the sign of an allergic reaction. You want to stop using the product and seek immediate medical attention. Next is injury to the nose, and this can be evident by severe or frequent nosebleeds. So if you're having severe nosebleeds and blood is just gushing out profusely, this is severe. Or if you're having frequent nosebleeds, you're having them every day or multiple times a day, that could be evident of some type of nose injury. Also, if you hear a constant whistling sound that doesn't go away, this could mean that you have a deviated septum or some damage to the nasal passages. If you have any of these symptoms, again, you want to stop using the product right away and seek immediate medical attention. Now again, Flonase is a steroid, so it can contribute to certain eye conditions like cataracts or glaucoma. It may cause cloudy or reduced vision. So while on Flonase, it's important to schedule yearly eye exams so that your eyes can be evaluated to ensure you're not developing any of these conditions. Now on this channel, we talk about lifestyle changes and over-the-counter medicines, and we mainly focus on adults. But with Flonase, it can cause growth effects. So if you have a child that's using Flonase and they're using it more than 2 months out the year, you want to make sure you talk to their pediatrician to assess their growth rate to make sure their growth is on par. And then Flonase can also cause some minor side effects like headaches, sneezing, minor nosebleeds as opposed to severe or frequent ones. And then it can cause dry or irritated throat. And if you have a dry or irritated throat, you can easily treat this with a nasal saline formulation and just make sure you're drinking plenty of fluids and water to moisten and wet your throat. So now we're going to talk about drug interactions with Flonase. It can interact with steroids, medicines used to treat asthma, allergies, or skin rashes, as again, Flonase is a steroid itself. So you generally don't want to take more than one steroid at the same time, but there may be some circumstances where it's okay. So if you're on other steroids with Flonase, talk to your doctor or pharmacist to make sure that's okay. It can also interact with certain HIV medicines like ritonavir or certain antifungal medicines like ketoconazole, as these medicines are what are called inhibitors. So what they do is they prevent the breakdown of Flonase in the body, so they can cause a higher than normal level of the medicine in the bloodstream. So if you're on these medicines, again, talk to your doctor or pharmacist to make sure it's okay to use Flonase. Now we're going to get into the bonus tips. I'm going to give you 3 lifestyle changes that you can make to help prevent or minimize your allergy symptoms. Number 1, as a rule of thumb, pollen counts are generally higher earlier in the morning, especially on hot, dry, and breezy days, as opposed to later in the afternoon or on wet days. So if you have allergies and you have activities to do or errands to run, try to run them later in the afternoon, in the evening, as opposed to in the morning. Coinciding with that, number 2, you want to check pollen counts in your area and reduce time outside when pollen counts are high. If you have an activity to do or an errand to run, try to run them on days when pollen counts are lower as opposed to days when they're higher. And then number 3, you want to take a shower after being outside, change your clothes when coming from outside, and wash your bedding frequently. Doing this will help minimize your allergy symptoms and will help you sleep better at night. If you have any questions about anything we discussed, let me know in the comments. And until next time, this is Brandon E., your Pharm.D. Remember to drink water and hope this video helps.